It's that time of the year where majority of patients are calling because they have a fever, they have a sore throat, they're coughing nonstop, and they're trying to figure out what is going on with me. Is it a virus? Is it COVID? Is it flu? Is it strep? What is going on? I'm Dr. Babs, owner of Life Wellness. It's a holistic and integrative direct primary care practice in Marietta, Georgia. So I want to start off by saying that suddenly anywhere between August, March is flu season. So it's advisable to get the flu shot, all right? Flu shot does not keep you from catching the flu, but it minimizes the symptoms. Another thing I want to emphasize is that you want to build your immune system, all right? We have to live life, we have to go out, be mixed in the community, so we have to build our immune system. How do I build my immune system? Making sure that I eat fiber-rich foods, plant-based foods. Majority of your foods, 80 to 90% of your meals should be plant-based because that's what's going to fight infection, right? Anti-inflammatory foods, the greener the better. Your fruits, your vegetables, lots of minerals and vitamins really help to build our immune system, right? The gut health matters, right? You feed the gut microbiome healthy, it will make you feel strong because a lot of our immune system is built in the gut. So you want to rest. You want to make sure you stay hydrated. 70% of the bodily functions run on water. So you got to stay hydrated, you got to rest, you got to move. You know, all these things are so important to decrease your risk of falling sick. One thing that I do is lemon water. I love my lemon water. Every morning I squeeze lemon in my water, and that's the first thing that I'm drinking, I'm sipping on throughout the day. So you want to make sure that you're doing that. Vitamin D is so important. A lot of us are very low in vitamin D. So if you just stay outdoors between 10 a.m. to 2 p.m., it's recommended 15 minutes, you get about 25,000 international units of sunlight, which is good for vitamin D synthesis. So definitely making sure that if you're low, make sure you're supplementing with vitamin D. That helps to build your immune system. Hand washing, hand washing, making sure you wear your face mask. If you're coughing, you stay home if you're getting a fever. So all of these things, let us put them in place, all right? Now, there's this Cosentin supplements. There's some supplements, and I'll list them in a comment. But there's some things that you can use to supplement and just help. A lot of people ask about zinc, vitamin C, Cosentin, all these things. Do they help? Yes, they can help, but that does not take away from just the kind of foods that we eat and all the different measures, preventative measures that you can take. Now, the biggest thing is to differentiate between if you're having a flu, if you're having COVID, or if it's just a regular, just a minor virus. So the biggest thing is that the flu, COVID, your body aches, joints, all of that, really feeling crappy, you're feeling fatigued, you're tired, you're coughing, you're sneezing. You can definitely test. And if you were going to, if it was flu, Tamiflu can only be administered within the first 48 hours, all right? There is a prophylaxis dose that can also be administered by your doctor if you've come in contact with somebody with a flu. COVID certainly is another layer of having the flu where you're having taste altered. Yeah, people are still getting the flu. COVID. So taste altered, nose, smell. So that can also be tested. A lot of these are also symptomatic treatments. So if there's a fever, treat the fever. We want to be very clear about having sore throat. If your sore throat started from scratch, nothing else, then you want to make sure that it's not strep throat, okay? It's going to feel like a razor is in your throat and you can't even swallow. That's strep throat that needs antibiotics. But if it's postnasal drip drainage, meaning sneezing, runny nose, antihistamine is always very good, and Flonase, you got to make sure you administer it the right way. Tilt your head. Flonase, spray into your nostrils 2 and 2 with Claritin. Use that at night. Very, very helpful. And then that helps to clear all that postnasal drip drainage that can lead to sore throat. So a lot of it is preventative. If you can't prevent it, if you do catch it, how can you just help with the symptoms that you're having. That goes back to your warm water. You might need ibuprofen and Tylenol, right? Bedside humidifier to moist the air. If you're taking Claritin and antihistamines, it can dry you out, so stay hydrated. Anytime because sometimes I have really bad allergies, especially during the flu season, I have to make sure I'm well hydrated because I could dry out so much that I'm coughing. All right, so there's a lot more to it, but this is basic. It's not limited to all the things that I said. Honey is really good, especially as we get into the allergy season, but I'm focusing on the cold and flu season. You want to just make sure that you are keeping yourself healthy, you're feeling strong, you're feeling energized, and see your doctor, see your healthcare provider if your symptoms are getting worse. All right, let me know if you have any questions, but I want you to remember that you deserve to live at your finest because yes, you are worth it.